Hi everyone, this is Mary Gregory with MAS Coding Solutions HIM Coding Academy, and also with the Medical Coding Lounge. I look forward to you all joining me in the Medical Coding Lounge. Go to www.mascodingsolutions.com and click on membership, and you can learn more information about the Medical Coding Lounge, where the lounge is for you to learn, grow, and connect with other great coders. Well, we are going to get into part 2 of talking about how the stork has delivered, and we're talking about newborn coding. You'll need to listen to part 1 in order to get the gist of the beginning, because we talked about the Z codes, how the Z38 is to only be used on the delivering hospital. It can only be used once. Now we're going to talk about conditions that could affect newborns. One of the biggest conditions that we see in coding a newborn is immaturity or prematurity. And so we want to talk about that. In your chapter 16, immaturity and prematurity coding start with P05. P05, because ICD-10 identified immaturity and prematurity in some different ways. P05 identified newborns that are what they call light for gestational age. Okay? You can have a baby that can be at the appropriate gestational age, but that baby weight is not where it should be for that gestational age. And pediatricians over the years have done a lot of research work, and they know what a 32-week-old baby should generally weigh. They know what a 37-week baby should generally weigh. And so sometimes the baby can go through the full weeks, but they don't weigh what they should. And so P05 is for your infants that is light for gestational age, okay? And the gestational, weight goes 500 grams and less all the way up to 2,500 grams. P05 also have a category for newborn, small, for, like I said, it's kind of interesting. P050 is for newborn light for gestational age, and then P051 is newborn small for gestational age. Now remember this, only physicians can make this determination. You may work in a facility where you deliver babies. Every baby has a chart, and every baby has a form within that chart that tells you what that baby APGAR is. That determines how healthy the baby is at birth. It's going to tell you that baby weight, and it's going to tell you the baby gestational age. Good pediatrician, which I haven't seen a bad one, pediatricians are great documenters. They're going to document for you the gestational age of that baby. They're going to document for you the weight of the baby. So you should always have weight and gestational age. You really should. You have some unspecified codes, but you should not be coding unspecified codes. You should have a way of finding out that baby gestational age, how many weeks that is, and the weight of that baby. And what I was getting at is that P050 says that you have a baby, that's the category. Now you have some additional characters in there, 7 characters, 5, 6 characters, whatever it may be. That's light for gestational age. Then you have the baby that's small for gestational age. A physician have to make this determination. If you have a baby that has a low birth weight, then if you need to query, you can query and ask a question about it. But you cannot code these codes simply based on the birth weight or the gestational age. You cannot do that. You also have the P07 category. P07 is for your extremely premature baby. These are extremely low weight newborn babies. Now remember, your Z38 gonna go first, your P code's gonna go second. And so once again, you got P071 for other low birth weights. Then you got P07 for extreme immaturity. This is a baby that's less than 23 weeks. And of course, the P07 is for your completed weeks of gestation. So remember, when you're doing newborn coding, and that baby is a premature baby, immature baby, like for gestational baby, what else? Small for gestational age, you're going to have at least 3 codes if the baby is born at your facility. You're going to have your Z38 code, you're going to have your weight code, which one of these is small for gestational age, light or immature. Then you're going to have your weeks. What is the weeks of gestation? If the patient is transferred to your facility from another facility, you only have the 2 codes, because Z38 cannot be used at the receiving facility. You're going to have the P code. You're going to have the weight. Was this an extreme immature patient? Was this just a premature patient? Was this patient just like small for gestational age? And then you're going to have the weeks of gestation in there. They also have P08. Now P08 is about large babies. You have exceptionally large babies, and they tell you underneath that implies a weight of 4,500 grams or more. Generally speaking, a lot of diabetic mothers, be they gestational diabetic mother or someone that was a diabetic before they got pregnant, they tend to have large babies. I don't think they have figured that one out yet. So you got we got exceptionally large babies. You got heavy for gestational dates. That's usually a baby that's 4,000 grams to 4,499 grams. And then you have a P082, late newborn, not heavy for gestational age. So you can have a post-term newborn. Generally, this may be a baby that mom went, 43, 44 weeks or whatever. 40 weeks is normal. Up to 40 weeks is normal. Anything after 40 weeks, now you're getting into post-term or post-date pregnancies. So you can have a baby that got a post-term newborn or prolonged gestation of 42 completed weeks. Now, once again, you cannot make that determination. That has to be done by a physician. And I have to say this because this is important. When you're coding newborns, a lot of the patient mother information is also on the newborn chart. And there will be times when the mother chart may say that the mom was 36 weeks. The pediatrician may document that the baby is 34 weeks. So now you got this discrepancy between the OB doctor and the pediatrician. You will code based on the pediatrician, not the OB. And they say the reason for this is because they use different criteria to determine dates and weeks. So always remember the pediatric or the pediatrician rule. The pediatrician documentation is what you're going to code on. If you work in a facility where, or maybe you're in charge of coding at a facility, and you feel that you want some clarification from the pediatrician or the OB, you may certainly generate a query and ask those questions to get the clarification. But without that, you're going to code based on the pediatrician note and not on the OB doctor note. So be aware of that. There are other conditions listed in Chapter 16 that you want to be aware of. And what those conditions are, there are times when the mom may have a problem, and that problem can be passed on to the baby. But once again, you got to have the documentation. So just because the mom has a problem, don't mean the baby's going to have a problem. You know how many charts you don't know? I have coded many charts where they said that the baby's in respiratory distress. And they'll do a C-section, they'll use a vacuum extraction, or whatever. Guess what? When the baby come out, the baby has no respiratory distress. The baby is just fine. Now, why it looked like the baby had respiratory distress in utero, who knows? There's a lot we don't know about, I think, pregnancy, delivery, and just the human body, really. There's a lot we don't know. So guess what? Because the baby does not have any respiratory distress when he or she is born, I'm not going to code respiratory distress on the baby. Yes, the C-section was done for respiratory distress, but when the baby come out, the baby wasn't in any distress. So I'm not going to code that. So be careful, just because you have codes that indicate that the mom had a condition doesn't necessarily mean that the baby have the condition. You know how many times we have done charts for preeclampsia? And I think you got a code in here. You can look at your P07 categories. Let's see if we got anything about, yeah, here we got P00, P000, newborn affected by maternal hypertensive disorder. Well, preeclampsia is a form of hypertension, okay? Now, so the mom may have preeclampsia. They may have to induce labor for it. They may have to do a C-section. But when the baby come out, the baby doesn't have any problem related to that. So if there's no problem related to it, you cannot code P000. If you want to code P000, then that pediatrician or someone, neonatologist, must document very specifically that the patient is having this condition related to the fact that the mom had the preeclampsia. So once again, you want to make sure your documentation is accurate. We're getting a lot of denials from insurance company because of inaccurate coding, where we are coding stuff just because the mom had it, and the baby, they're saying the baby have it, and the baby don't have it. And so watch out for that. There's some very specific code for infants of a diabetic mother syndrome. We got those. You also got some very specific code for when a baby's born to an alcoholic mom or a drug abuse mom. There are some coding guideline issues that has been issued on, especially the drug, when a baby's born to a drug addicted mom or alcohol addicted mom. They said those babies always gonna have some issues, so generally they allow us to make to code those P codes on those babies. Generally too, you're going to see that those babies are definitely treated different. You may see where they would say that they put the baby in a separate area. They said babies born to drug abused mom, they tend to be very nervous. They can't handle noise. And so they are treated differently when they are born. And of course, they're going to be doing more blood work on these babies to see if any of those drugs and or alcohol has been transferred to the baby. So hopefully this will end our presentation. Hopefully it will help you in your coding, your everyday coding. If you're new to coding, it definitely will help you if you're taking the CRC or the CPC or the CCS. It will help you to understand and to get the correct answer when you take the test. Don't forget to follow me on LinkedIn and Facebook. We have our website, www.mascodingsolutions.com. And, I'm on TikTok. So make sure you go out and join me on TikTok and become a member on TikTok. And I just look forward to our next presentation and being an instructor for you to help you to grow in your coding and to become the best coder out there.